Clancy trial has a really unusual twist that most people don't know about. By the end of this video, you'll understand this trial better than almost anyone else talking about it. First, the twist. Almost everywhere in America, if you claim insanity in your defense, you have to prove it. It's your lawyer's burden. But in Massachusetts, it's backwards. Once her defense raises it, the prosecution has to prove she was sane and beyond a reasonable doubt. That's the highest bar in American law, and it's pointed at the state. If you haven't followed the case, here's a quick 15-second recap. In January 2023, in Duxbury, Massachusetts, a 32-year-old labor and delivery nurse named Lindsay Clancy killed her 3 children and then tried to end her own life. She survived, but is paralyzed from the waist down. She admits she did it. Her lawyer says she was not in control of her mind. Her trial just started in July 2026 and is still ongoing. 3 things I'm going to show you. 1, the prosecution's best evidence is that she checked how long her husband's errand would take. I'll show you why that might not decide anything. And there's a clinical reason for that most people have never heard of. 2, more than 30 countries have a specific law for cases exactly like this. The United States has none. The reason goes back to a law from 1624 that presumed mothers were guilty of murder. 3, the screening test that nearly every new mother in America fills out cannot detect the illness at the center of this case. It was never built to. And in between all this, there's one warning sign that families miss, both in new mothers and in aging parents, for the exact same reason. So if you're caring for either one, that part alone is worth your time. Please send this video to someone else who needs to see it. I'm Neil K. Shah, a Johns Hopkins and NIH-funded caregiving researcher and the CEO of CareYaya. I've helped thousands of families navigate aging, dementia, and serious illness. I'm not a clinician, but a leading researcher and innovator in caregiving. One more thing here before we start. 3 children died here, Cora, Dawson, and Callan. Nothing here is a defense of that. This is about what the law is actually asking and what science can and cannot tell us. So first, let's talk about what is known. Lindsay Clancy was a maternity nurse. She was on leave from Massachusetts General Hospital, one of the best hospitals in the country. On January 24, 2023, her husband left to pick up food and a prescription. While he was gone, she killed their 3 children. Then she went out a 2nd-story window in a suicide attempt. She fell more than 20 feet. She lived, but she uses a wheelchair now. She has never said she didn't do it. This is not a mystery about who did it. Her lawyer, Kevin Reddington, is arguing something the law calls lack of criminal responsibility. Most people just call it the insanity defense. The trial is in Plymouth Superior Court in front of Judge William Sullivan, and it just started in late July 2026. As I record this, there's no verdict. But the law, the science, and the history I'm about to explain will give you real insights into what's going on here and why it's so difficult. First, Massachusetts doesn't use the word insanity. It uses a test from a 1967 case called Commonwealth versus McCool. Picture 2 doors. The defense only has to go through one of them. Door 1, at the time, did she lack the ability to understand what she was doing was wrong? Door 2, even if she did understand it, that it was wrong, did she lack the ability to stop herself? So door 1 is about knowing, door 2 is about controlling, and they're totally separate questions. Almost every news story covers door 1, but very few mention that door 2 exists, and I think door 2 is a big deal because most of America threw it out before. 40-something years ago, back in 1981, John Hinckley shot President Ronald Reagan. In 1982, a jury found him not guilty by reason of insanity. The entire country was absolutely furious. 2 years later, Congress passed a law that deleted door 2 from all federal cases. A wave of states copied it within about 2 years. 4 states, Kansas, Montana, Idaho, and Utah, even got rid of the insanity defense completely. But Massachusetts kept both doors. So now look at the prosecution's strongest evidence again. They say that she checked how long the husband's errand would take. They say that proves planning, and planning proves a working mind. But here's what I think almost nobody explains. In forensic psychiatry, there's an idea sometimes called organized psychosis. A false belief sets the goal, but the ordinary machinery of the brain, like timing, sequence, and simple steps, can still keep running underneath it. Think about it like a car with a steering wheel that's broken, but the engine's still working fine. It still moves ahead and drives. It can still go fast. It just isn't going where a healthy mind would want it to go. So being able to just organize 20 minutes doesn't prove she could stop herself. It's a different legal question Massachusetts law asks both. That's the first thing the coverage is missing. Here's the even bigger one. Most of us assume that if you claim insanity, you have to prove it. In federal court, that's true. The defendant has to prove it. But Massachusetts flips it. Once the defense shows enough evidence to raise a real question about mental illness, the burden of proof moves to the prosecution. The state then has to prove that she was in control beyond a reasonable doubt. Think about how hard that is. They have to prove beyond a reasonable doubt what was happening inside a person's mind during a moment that nobody witnessed. Now let me fix two things that almost everybody believes. First belief, people think that the insanity defense is a loophole that accused criminals use all the time. It isn't. In a major 8-state study by Callahan and colleagues, it was raised in about 1% of felony cases, and it succeeded in about a quarter of those. So that's roughly 1 in 400 cases. Second belief, being found not guilty by reason of insanity doesn't mean you go home. It just doesn't. In Massachusetts, that verdict sends you to a locked psychiatric hospital. There's an evaluation period, then a 6-month order, then renewable 1-year orders. You get out only if a court decides you're no longer mentally ill and you're no longer dangerous. There's no end date. Research has found that people found not guilty in this way are often locked up as long as or even longer than people who are convicted the regular way. Nobody just walks out. That's not how it works. It's just how television says it works. So where did this whole idea come from? A shooting in London back in 1843. A Scottish woodworker named Daniel Macnaghten believed the British government was hunting him. He went to Whitehall to kill the Prime Minister Robert Peel. But he shot the wrong man, Edward Drummond, Peel's secretary. Drummond died 5 days later. Macnaghten was found not guilty by reason of insanity, and the country lost its mind. Queen Victoria was especially angry, and she had personal reason to be so. Someone had already shot at her. In 1840, a teenager named Edward Oxford fired at her carriage, and he had also been found insane. So Queen Victoria wrote to Peel, the Prime Minister, and demanded to know about this law. So the House of Lords called in the judges of England and made them explain themselves. The answers became the Macnaghten rules. Those rules shaped the insanity defense across the English-speaking world for the next 150 years. Now here's the punchline. Look what's in those rules. Only door 1. Only whether the person knew it was wrong. The door 2 that exists in Massachusetts isn't there. The part about did the person lack the ability to control themselves. One furious queen in 1843 helped set a legal test that most of the United States still uses today, but Massachusetts is one of the few places that decided that was too narrow. Now, the medical part, and this is where I think the news coverage completely falls apart. People mix up 3 totally different things. 1, the baby blues. Up to 80% of new mothers have this. Crying, mood swings, usually goes away in 2 weeks. 2, postpartum depression. 10 to 15% of mothers experience this. Deep sadness, exhaustion, no joy in anything. 3, postpartum psychosis. About 1 or 2 births out of 1,000. This is like an emergency. Things like false beliefs, hearing things, confusion. And it comes and goes hour by hour. A lot of new mothers get what are called intrusive thoughts. Sudden, awful flashes of something bad happening to the baby. And the key part is normally those thoughts horrify the mother. They feel totally foreign, like they're not even her own thoughts. Mothers who have them usually work extra hard to keep the baby safe because the thought scares them so much. That's the common version, and it's often treatable. It does not mean she's dangerous. But in a psychotic episode, something can completely flip. The thought stops feeling foreign and starts feeling true. She stops fighting it. And in postpartum psychosis, it often shows up as a rescue idea. Not, I want to hurt my child, but almost closer to thinking, I have to save my child from something worse. Same kind of thought, but completely opposite relationship to it. And from the outside, like in a text message or in a 15-minute appointment, those 2 states can look almost the same. Court testimony has established that in late 2022, Lindsay Clancy contacted a psychiatric provider about intrusive thoughts, brain fog, and bad anxiety. She was told that intrusive thoughts are common in postpartum depression and anxiety. That is true. It's genuinely true and usually the right thing to say. So we can't necessarily say that the provider did something wrong here. There may be lawsuits to settle that matter. But what we can say is that this call is genuinely hard, and the tools that we hand clinicians to make the call are worse than you'd guess. The standard screening form used across America, like in maternity care, is the Edinburgh Postnatal Depression Scale. It's a good form. It screens for depression. It does not screen for psychosis, and it does not screen for bipolar disorder. That last one matters enormously because postpartum psychosis is closely tied to bipolar disorder. A landmark 2001 study by Jones and Craddock found something really startling. Among women with bipolar disorder who also had a close relative who had postpartum psychosis, the risk of them having it was about 74%. Think about how high that is. So a woman can fill out her form, pass that test honestly, and still be sitting on the single biggest known risk factor for an illness that nobody has screened her for. Now, I want to relate this to the caregivers watching. The defining feature of postpartum psychosis is that it comes and goes. Someone can be perfectly clear at 2 o'clock in the afternoon and deeply confused by 8 at night, then clear again in the morning. If you've cared for an older adult, you may already have seen this pattern. There, it's called delirium, and it's extremely common, especially in hospitalized older adults. It also gets missed constantly, and people miss it for one specific reason. They say she seemed fine an hour ago. I think that sentence is a trap. In both of these conditions, the good hours are not proof that the person is okay. The coming and going is the illness. Being normal part of the time is a symptom, but it's not reassurance. So here's what to actually do. And it works for a new mother and for an 80-year-old facing delirium. Don't just judge by one moment. Write things down over several days and write down the time. If someone is sharp in the morning and confused at night, that swing is what to report to the doctor. Not just the good hours, not just the bad hours, but the on and off pattern. And if someone tells you about a thought that frightens them, the most important question isn't what the thought was, it's whether it still frightens them. When a person stops being scared of a thought like that, get help immediately. That is the greatest moment of risk. Please share this part with others. Most people have never heard it, and I think it could be genuinely useful. Now to the part that the defense has built its case on. Over about 4 months, from roughly September 2022 to January 2023, Clancy was prescribed a long list of psychiatric medications, antidepressants, an antipsychotic, several anxiety medications, sleep medications, an older drug called a tricyclic. The Boston Globe reported 13, a court filing said 9 over a slightly different window, a TV analyst said 15. It's hard to give a precise number because these sources disagree, but let's estimate it at around a dozen different drugs over 4 months from several different prescribers. Really, I think the who matters more than the count of drugs itself. Court testimony describes outpatient providers, emergency room visits, and an inpatient stay at McLean Hospital, with clinicians often unable to see each other's records. That's the failure at the center of this. Nobody seeing her was truly understanding the whole picture. Everyone was just seeing a piece of the puzzle. The defense has 2 medical arguments, and let me give you both, and then also let me present the other side. 1. Akathisia. This is real. It's a side effect usually from antipsychotics, sometimes from antidepressants. It's not ordinary restlessness. It's a severe physical, inside your skin type agitations. Patients often describe it as unbearable, and it gets mistaken for anxiety all the time. 2. The mood switch. There's a well-known worry that giving antidepressants to someone with undiagnosed bipolar disorder without a mood stabilizer can tip them into a manic or mixed state. No sleep, agitation, and sometimes even psychosis. Both of those are real things. But now here's the other side. The link between akathisia and violence is weaker than the internet claims. A 2021 review by Kalniunas and colleagues looked at whether akathisia is linked to suicide behavior. They found only 4 usable studies. 2 showed a weak link, 2 didn't even support it. Their conclusion was that it can't be reliably linked. If the suicide link is that shaky, then the violence towards others link, which rests mostly on individual case reports, is even shakier. No psychiatric medication in America carries a warning about homicide, not one. Antidepressants carry a warning added in 2004 and widened in 2007 about suicidal thinking in people under 25. Ambien even got one in 2019 about sleepwalking and sleep driving. Anxiety medications got theirs updated in 2020. And proving that a drug caused one specific act in one specific person is close to impossible. To do it, you'd have to rule out the illness, but the illness is why the drug was prescribed in the first place. You usually can't separate the 2 factors. So what's the scorecard here? that postpartum psychosis is real, dangerous, and badly underdetected, that a dozen different medications from completely uncoordinated prescribers is just bad healthcare. The claim that akathisia causes violence, that's weaker. And that any specific drug caused what happened that day, no one can know. Which brings us to the evidence that I think has been read most wrongly. 2 days later, a psychiatrist examined Clancy in the intensive care unit. She had a breathing tube. She answered in writing. The exam reportedly found her alert, thinking in a straight line with no obvious signs of active psychosis. The prosecution has leaned on that hard. See, she wasn't psychotic, they say. 3 problems here. First, what kind of exam it was. A bedside hospital consult usually answers a very narrow question. Is the patient safe? Can she agree to a medical procedure? In her case, spinal surgery. Deciding whether someone can consent to an operation is a completely different job from reconstructing her mind 2 days earlier. Second, the coming and going problem, the exact thing we just covered. Being totally clear on Thursday tells you very little about the mental state on Tuesday, in an illness that's defined by its fluctuations. And third, this is barely discussed. Her body was not the same body. At the hospital, she had survived a fall of more than 20 feet, a spinal cord injury, heavy blood loss, and a cardiac arrest. She'd been given emergency trauma drugs, and her entire psychiatric medication routine had likely been stopped cold. So whatever her brain chemistry was on January 24th, it was not that on January 26th. By the way, that's not proof that she was psychotic, but it means that the exam at the hospital is weaker evidence than it's been sold as, in both directions.